we want to test the active range of movement of the cervical spine. So first, we want to compare the both sides got any pain or any restricted movement. So first, I want you to just look down and chin tuck, and then after that look out to the ceiling. Okay, and then look in the front, and then turn side to side. Okay, yep, and then other side. Okay, to see any imbalance or not, and then and side bending, like shoulders to the ear, yeah, ear to shoulder, yeah, and then another side, yeah. So this test to see any pain.
No pain.
No pain. Okay. So now we're going to perform the pavement cervical flexion and extension assessment. So first we're going to make sure in the supine positions, and then put one hand to support the occiput, and then another hand fingertips in the between the spinal process. So now I'm going to flex the head by extend my knee, and then by dropping the head in extensions, I'm going to bend the knee. Okay, so now we're going to do the pavement with the patient on the prone positions, and then we're going to do the PA-CVP. So our thumb is going to find the spinal process of C2, and then we slightly move our fingers and shoulders pressure down to the spinal process, and then to check any stiffness or tensions on the spinal process. And then after that we're going to move down to C3, do the same. Okay, and then move all the way down to T1. So now it's C6, C7, and T1. I'm going to do the Sterling test. So at first, just have to do the cervical extensions and lateral flexion to the affected side and slightly rotations. And then now I'm going to do the compress downwardly, and then if the symptom produce to the from neck or shoulders pain, and then that's a positive sign. Okay, so if the pain produced after the Sterling test, we want to do the distraction test, see whether the pain will relieve or not. So first we have to put the patient in the supine positions and put both our hands behind the occiput and slightly distract by pulling the head away. Yeah, if the pain will relieve, there is a sign for positive test. The ULTTA, first we're going to depress the shoulders and abduct the arm to 110 degree and flex the elbow to 90 degree. Lateral rotate the shoulders and extend the patient's wrist and fingers. After that, slowly extend the elbow until the symptoms are promoted. Is it good?
Right.
So now we're going to perform the ULTTP. By perform this one, we got to depress the shoulder from our hips, and then abduct 10 degree shoulders, and then flex the elbow to 90 degree and supinate the forearm, extends the fingers and wrists, and slowly extend the elbow until the symptom provided. Again, to confirm the finding, we can create some slack by flexing the arm and then ask the patient to lateral flex the neck to the opposite side to create the tension again. Okay, so now we're going to perform the ULTTC. To perform this test, we're going to depress the patient's shoulders with the hips, and then bring the arm to 10 degrees of abductions, and then flex the elbow to 90 degrees, and pronate the forearm, and flex the fingers, and then extend the elbow slowly until the symptoms are provided. Again, if we want to confirm the finding, we can ask the patient to flex the neck into a positive side to create tension. Okay, thank you. Okay, to perform the LTTD, first we're going to depress the patient's shoulders and then abduct the shoulders 90 degrees, and then pronate the forearm, extend the fingers and wrists, and radial rotations of the shoulders, and slowly bring the fingers toward the ear. How do you feel?
I'm starting to feel it.
Feel it? Okay, let me know if too intense, okay? Again, if the patient create a tension again, you can ask the patient to slightly bend to the opposite side.
Cool.
Okay. To perform the thermotome test, and then start with the patient to close the eyes, and then try to feel two objects is sharp and soft from C3 to T1. Okay, so just tell me what do you feel? Okay, so start with C3.
Soft. Soft. Hard. Hard.
Okay, and then C4.
Soft. Soft. Hard. Hard.
Okay, good. And then C5.
Soft. Soft.
And
hard. Hard.
Good. And then now to go to C6.
Soft. Soft. Hard. Hard.
Okay, good. And then now go to your palm up. Okay. And then C7.
Soft. Soft. Okay. Hard. Hard.
Good. And C7.
Soft. Soft. Hard. Hard.
Okay, good. And last one is T1.
Soft. Soft. Hard. Hard.
Good. Okay, so now we're going to perform the monotone test for cervical. So first is a C1, is a neck flexions. Okay, so try to not let me move you. Okay, and C2 is a neck extensions. Okay, try to not let me move you. Okay, and then is C3 is a lateral flexions. Okay, both sides. Okay, is there any pain? No. Okay, good. And then C4 is shoulders elevations. Okay, good. And then C5 is shoulders abductions. Okay, so try to raise it. Okay, and try to raise my hand. Good. And then C6 is elbow flexions. Okay, so like this. Okay, try to not let me move you. Okay, and then C7 is elbow extensions. Okay, and then it's good. And then C8 is a thumb. extensions. Okay, so I gotta grip it and try to push my hands. Yep, like this. Good. And then the T1 is fingers abductions. So try to put your hand like this, and then I'll put my hand finger in the between and try to abduct your fingers. Yeah, that's good. So we want to compare both sides, any weakness or reproduce the pain.